Well, my father was a doctor, and he seemed to really enjoy his work. I was raised to want to help take care of people and make the world a better place. And so I followed in my father's footsteps. I'm Maryl Kreider. I'm the director of the Interstitial Lung Disease Program here at Penn Medicine. My favorite role models when I was in medical school were all pulmonologists. And I thought the most fascinating diseases were ones that included lung diseases. And so the combination really drew me into pulmonary medicine. I'm the director of the Interstitial Lung Disease Program, which is a group of rare lung disorders that affect a compartment of the lung called the interstitium, which is the space between the air sacs and the blood vessels. When something takes up shop in that space and causes a roadblock, making it hard for gas exchange to occur, you get something called interstitial lung disease, and that makes it very hard for people to breathe. There are more than 200 different interstitial lung diseases. It's not a specific diagnosis, it's really a family of lung disorders, but it has a fairly insignificant impact on the people it affects, and I find it a fascinating group of disorders, but it also allows me to really not only make important diagnoses, but make a big impact on the quality of life of the patients I care for. Because these are unusual and rare diseases, Penn has become a place where people like to refer to these diseases because we specialize in the diagnosis and the treatment of these diseases. I think what makes us unique at Penn is several things. One is that we have a large group of us who focus on these rare diseases. We are multidisciplinary, meaning that we have physicians, advanced practice providers, pharmacists, social workers, a transplant team, rheumatologists, surgeons, etc., like across the gamut, all of whom are very comfortable and familiar with this and who are focused really on the patient and the patient experience and want to help people get through what is a difficult group of diseases and all that uncertainty. And we're not just focused on what do you have and here are your choices, now you're done, but really on helping at the beginning and then throughout the course of the disease. It's a partnership that we start at the beginning and then want to stick with you throughout the journey. I think it's the little things that inspire me. It's when patients say, I was able to go on that vacation that I really wanted to go on. That was a little easier than it used to be. Or I didn't think I'd be able to do that again, and you helped me figure out how I could do that. It doesn't have to be the wedding. It doesn't have to be the big things. Sometimes it's the little things.